Yeah, so coming to what are the other tests which we try to work with autism are basically when we work with the SPEC PET as well as functional studies for a functional MRI or something like that, we are able to see there are a lot of people who are having some unusual function in the frontal areas, number one, and a group of autism which shows reduced perfusion, reduced activation into left dorsolateral prefrontex during the memory task. This is one of the things which were reported, and some of the other things which I do is like EEG electroencephalogram, and which rules out there is any seizure disorder and related condition. Sometimes a single normal EEG does not rule out autism, and apart from that, we do something like urine porphyrin test, and where we are trying to check out what exactly is happening at this level, where this is a simple marker where I can always tell, yes, the child has got mercury, or the child has got lead and aluminum and all that. In a content in the body can be estimated by just checking the urine porphyrins. And yes, it was difficult when I started my thing as a Western trained physician. We historically know autism as an incurable disease with no treatment. So why bother diagnosing these children? I believe with alarming increase in the incidence, much research is underway, and yes, I think we as a professionals has and I had seen these children having coexisting morbidities, coexisting medical conditions, physiological conditions that needs to be addressed. Something like this is emerging failed but lacking clear-cut treatment protocols, and much of it sounds alternative to most of us, so seemingly dismissible. With whatever I work, despite the lack of proper evidence-based approach, there is much anecdotal and circumstantial evidence that some of these treatments can be effective. This is most of the patients who have spent some time researching this medical treatment aspect of autism will agree that they are worth a trial. And yes, it is one of the important things. Autism seems to be composed of multiple diseases presenting with similar symptoms. So there is not one treatment that works for everyone with ASD. It is the extreme variability demands a highly individualized treatment plan, and sorting through this even for one child can be a monumental task. And I strongly urge people, or usually physicians, to work along with the parents, and strongly encouraging them. I tell the parents to become their own child's case manager. Might be best conceptual approach. It's also important to keep in mind that many of these parents are already overwhelmed with the child's needs, and usually they are trying to look at answers, on the Google and all. And yes, it is an overwhelming thing, I said, but I always believe unless you ask them to look into things can't be progressed well. So now, many researchers believe that autism is triggered by autoimmune process, and affecting multiple systems, including GI tract, the brain, and the liver. And I also do those. I believe this autism is a multi-system involvement. It is not just the neuropsychiatry. It has something to do with the gastrointestinal tract. It has something to do with the intestinal immune system, because we have seen there's a thing called myelin basic protein antigens. Antibodies are found in the children with autism. These are the autoantibodies. It's a problem with the immune system. It's a problem with the endocrines. It's a problem. See, this is a kind of this is one of the big things which I believe is causing all the other problems basically. So yes, when we look into this particular things, Sometimes we try to look at GI endoscopy, gastrointestinal endoscopy, has shown a lot of numbers of autistic kids has esophagitis, duodenitis, colitis, and lymphoid nodular hyperplasia. So whatever we are trying to tell them, this is evidence based. It is not just this is not a psychiatric problem. The child is suffering with esophagitis, duodenitis. That's the reason he tries to bang. He tries to. This is the he is hyperactive. He is not able to. He's trying to press his tummy towards any pointed objects is because of this. And most of these children has allergies to milk and other things as such. Most of the kids having autism has 90% of them they have low sulfate values. There is a thing called phenol PST intolerance, and I have been fortunate to work in this particular field, and this is the key to detoxification. And most of these things are very low in autism. There are some things which normally this is how we try to work it out. You need that glutathione good levels too. For that, glutathione peroxidase, you have got something like superoxide dismutase. We are found to be much lower than in the controls in autism. So the reason the glutathione is low is because of this glutathione peroxidase and superoxide dismutase is very low in this people. So again, I believe that many autistic behaviors are manifestation of physiological conditions. For example, head banging and sleep disturbance may be response to a inexpressible pain. It's quite plausible. The addressing this physiological mechanism abnormalities will result in significant improvement in the autistic behaviors and consequently more effective educational interventions. So yes, the key is early intervention is the key, and I always believe educational programs can have profound effects, especially when combined with medical interventions, and that improve attention and behavior. We need to take both the things together. So yes, this is how we try to assess the autistic kid and try to work with all this particular process, which can be starts from the. I usually try to start from the GI tract because most of the kids are suffering from esophagitis, duodenitis. They have constipation, they have diarrhea, and so this is one thing which may be responsible for some nasty things as such. Most of the kids has got some fungal yeast overgrowth in the gut, and just by removing this dairy products as well as wheat and all that other things, they're convincing these children they start improving. And usually this is how we try to work on our protocols. And yes, I do work on something part called sulfation also. I can't be totally giving this particular stuff, but somewhere this is the thing where when we start taking this heavy metal accumulation, they also play a role as well. And I will be going for the chelation therapy or the last kind of thing. Usually I work with trying to improvise the detoxing skills of the kid, and once the child starts sweating and the child has GI, he doesn't have constipation or something like that, his GI issues are getting sorted and all that, usually the child will start doing his own detoxification by himself. Because we do believe that you need to work on the detoxification. It's an important thing, but if you can improve on the physiology and all that, things are better. So, and apart from that, you need to reduce the toxic burden in these kids. And so toxic burden, invariably so many things are interrelated. Once the toxic burden, someone understands about toxic burden, but for me trying to the challenge is trying to tell convince the parents that you need to the parents also need some detoxification. and you cannot have a continuous kind of thing. Something like Wi-Fi will be open 24/7, and you are all in the kind of you need to look into that. You cannot have a microwave in your home. You cannot have lot of things which we believe is once it will help the child, particularly autism kids, to start recovering on his own. So we start talking about this. This is how we should look into what to do when you have autism. And yes, I will just again give you the basic things. We need to it's a kind of genetic susceptibility as well as toxic insults, especially vaccines and mercury in the vaccines to autism, and try to understand what's the biological treatments approaches to autism. And yes, when you understand this genetic susceptibility with time sensitive toxic insults, and what exactly I mean to say by genetic susceptibility is people having impaired MTHFR. Impaired MTHFR is very common. This is a methylene tetrahydrofolate reductase enzyme, and this is one of the, and apart from that you have got impaired sulfation in the form of solitary polymer nucleopolymorphisms, GSTM1 and GSTP1. These are the things. Apart from that, you have got something like ApoE4 abnormalities also, and most of the kids, autistic kids, have got impaired metallothionein function. So this is a combination thing, and there were a lot of genetic tests and all that were done. Genetics of identical twins of both autism, like fraternal twins, were selected, and 20 or more genes have been associated with autism. So this is one thing which I always, parents with one autistic kid has odds of 5 to 8% of future children having autism. And sometimes that's the reason we try to work on this thing called epigenetics. And I think genetics alone cannot cause epidemics, and genetics load the gun, environment pulls the trigger. So what has happened in just 20 years, autism has increased from 1 in 2,500 or 1 in 10,000 births to 1 in 100, probably 100 births, something like that. So so this is something which is cannot be explained only by genetics. It can happen with this epigenetics. We can always have a yes, these are all the things, facets, and we believe autism has to be worked out in a proper way. And yeah, we do understand the likely chain of events, and if I try to give you a kind of thing, how things, likely chain of events that leads to autism. And maybe I always tell this particularly for the doctors and all that, to whom I normally give some lectures and all, but it is basically it's just not just vitamins, B6, B12, magnesium, suboptimal. There are cell defenses against toxicity and infections are hampered because of this nutritional status. You have genetics of suboptimal metabolism, one carbon group of folate, transmethylation, transsulfuration, adenosine or glutathione, and you see something like food allergy, especially milk and meat allergy, and the concern. So you need to look at this toxic exposures to mercury or thimerosal, antimony, arsenic, organophosphates, petrochemicals, and solvents. With that you get something like hampered, which gets, what happens is that your DPP4 as well as methionine synthase, as well as folate chemistry, and that glutathione goes out of kind of thing, out of balance. And so here are the things, these are the chain of events which leads to autism. There is a methionine metabolism, and methylation becomes deficient, number one. You have a phosphate delivery to neurons via creatine is subnormal, causing unreliable and inadequate energy for neurons and networks to operate and coordinate. This is the most important thing. If you can understand what is this phosphate delivery to neurons via creatine, which is the main thing, which is under for neurons to effectively work, you need a phosphate delivery to the kind of stuff. So yes, we are talking about too many things here: magnesium, phosphate, calcium. But this particular thing, compromise cell defenses, allow measles and other viruses to invade cells, and low abnormal immunity allows infections to become persistent, and particularly measles in particular, which causes inflammation and gut dysbiosis. So methylation of these phospholipids near the dopamine 4 receptors in neurons become deficient, and persistent brain infection by measles may also cause this lack of neuronal phospholipid methylation. So this phospholipid, see, this deficient frequency modulation and deficient energy modulation of neuronal networks during the first 2 years of life prevent adequate interneuronal interconnection of neuronal networks. So the result is coordinated thoughts, organized responses, and express speech regress or do not develop depending on the age. Like this is the likely chain of events linked to autism. I believe this is the Dr. John Pangon and Sidney Baker who told this. Biochemical, epistatic, and infectious gridlock occurs, and neuronal network coordination remains deficient in autism. Kind of big take, you know. This is Sidney Baker, and these people have done a great kind of work. This was in 2005. So what happens is this inflammation of the gut and brain results in cytokine and oxidant-induced epigenetic changes, such as upregulation of some chromosome 15, ubiquitin ligase. So methionine metabolism is routed away from methylation towards transsulfuration. But transsulfuration is disabled and the metabolic response to inflammation is chronically deficient. So this is the kind of hallmark things which happens in the autism, which is the main cause of this neuronal network grid, epistatic infectious gridlock. This is the problem with autism. So I always believe why these coordinated thoughts, organized responses, and expressive speech regress or do not develop in this autism. It is because of much more things which we need to work at the biochemical level, and this is the kind of thing which we are trying to work with the kids, trying to see that these things get restored.